Okay, so today we will discuss about referral system. Okay. So as the word suggests, referral means we refer the patient from one center to another center. Okay. Actually, what is the proper process or the definition of a referral system? Normally in examination, you get question about explain referral system or sometime write short note on referral system. Okay. So in referral system, you need to tell about what is the definition, what are the objectives, what are the benefits of referral system, and what is the actual procedure for referral system. So, what is the referral system? Referral is a process in which health officer at one level of the health system having insufficient resources like drugs, equipment, skills, etc. to manage the clinical condition seek the help of better or differently resourced facility at the same or higher level to assist. Okay, so this is the whole definition. It is the process where the medical officer of one center, for example, medical officer sits in PHC at the lowest level. Okay, so from PHC the referral system starts. Okay, and this is known as first referral. Okay, and yesterday we discussed which is the first referral unit, that is CHC, because through first referral client is referred to CHC first time. Okay, that's why it is known as first referral unit. Okay, and what is second referral unit? Normally from CHC the client is referred to district hospital. Okay, sometime sub-divisional hospital even, and sometime district hospital. That will be second referral. Okay, so the medical officer will first check or use its own sources like medicine, etc. And if he find that these resources are insufficient to treat the clinical condition of a patient, then he will transfer to the higher authority or higher center. So this process is known as referral system. Okay. Now the referral system play a vital role in the management of disease in any healthcare center. Okay, it is very important. Okay, it is vital because once a client reaches to the medical officers like at PHC, he should be in safe hands. Whether he need tertiary level care, whether he need secondary care level, he should get it through a referral system. Okay, so this is the responsibility of the treating medical officer, that he refer the client appropriately so that he can get the best possible treatment. Okay, an effective referral system ensure close relationship between all levels of the health system and help to ensure people receive the best possible care closest to the home. Okay, so all the referral units like first referral unit, second referral unit and third referral unit, they should have communication. Each unit should know that from where the client may come and to where we have to send. Okay, so this communication level or chain of communication should be there for better care, and the care should be best as well as closest to the client. Unnecessarily we should not send to the higher center. If we can treat at our center, we should treat, otherwise we can send. Okay, so this is the importance of referral system. It also assists in making cost effective use of the hospital and primary health care facility. Okay. It is very cost effective because the hospital caters the patient who need higher care, and the primary care facilities, they treat the cases which need less specialist services. That's why the client are distributed. Otherwise what will happen if we are not doing our work properly at primary level? All patients will reach to hospital and they will overburden the hospital system. Okay, that's why the primary services, they should also work as per their resources, and as per need they should send the client to the higher authorities. Okay. Now, what are the objectives? Why this system was prepared? This system works everywhere in all the countries. Okay. The objective of referral system are, number one, to take expert opinion for the patient. Okay. The treating doctor takes expert opinion from higher authority if needed for the patient. Okay. Second, to get additional health services for the patient. If some services are not available at the lower center, then those services can be taken from higher center. Then another objective, to seek better treatment for the patient. Okay. If the higher services needed, then the services can be taken from higher center. To provide super specialty services for the patient, and sometimes if super specialty services are needed, for example, we can say that if the client comes with pain abdomen to the PHC, then first he will try to provide care like giving antacids, pain is relieved. But if pain is not relieved and the doctor thinks that there may be some intestinal cancer or specialist problem is needed, then he will refer to higher authority, and he will also write that the client may be suffering from cancer. So from second authority, he will be referred to specialist authority. Okay. So this is the objective, that the client once enter in the hospital should receive best possible treatment and correct diagnosis should be made. Okay, for the any disorder. So these super specialty services should be provided. Then to seek high-end diagnostic and therapeutic tool. Sometimes treatment may be available at the center, but diagnostic services are not there. Like at PHC, doctor is enough experience to treat the some problem, but he want that the client should undergo ultrasound. But ultrasound facility is not available at PHC, then he can refer for this diagnosis only, and then the client can come back. Okay. So to seek the high-end diagnostic and therapeutic tools. Now what are the principles? Okay. The principles means we should, before referring the client, the doctor should see that, number one, before referral, the referring physician should exhaust available facilities for the diagnosis and treatment. First, he should see that what facilities are available at his own center. Just when patient come without giving any medicine, he is referring. This is not good. Okay. So first principle, first he should use the possible available resources at his own center. Then only he should refer. Okay. If it is not working, otherwise he should not refer. Then patient should be given optimal care at right level, right time, right cost. Okay, everything should be appropriate. Okay. Then optimal and cost-effective utilization of healthcare system. Okay, we have healthcare system, sub-center, PSC, CSC, divisional hospital, then district hospital, super specialty hospital. So there should be proper use of these centers. Every center should get patients, and they should be treated as per their services level. Okay. There should not be a system that all patients should visit to district hospital, and on the staff on PHC they are sitting idle. Okay. So every center of the whole health system should be properly utilized. Okay. Then optimal and appropriate utilization of specialist service for needy people. So for the higher services, only needy people should reach there. All should not reach this. Then next principle, optimal utilization of primary healthcare facilities. And what are the primary healthcare facilities? All these centers, sub-centers, CHC, PSC, they should also be utilized, especially for lower type of problems like fever, then diarrhea. They can be treated at sub-center or even PHC. Why to send to district hospital? Okay. So this is the principle of referral system. Now third question comes, that what is the process of referral? How we refer? So first of all, referring physician. Referring physician means the physician who starts referral is known as referring physician, and normally referring physician is PHC doctor. Okay, so he will prepare referral slip or client referral form. Okay, referral slip is there, he will prepare that slip, and this facility or this center is called as initiating facility. Okay, whoever starts the referring process is known as referring facility. They prepare outward referral for the higher center, and they communicate the client's condition, status and treatment given on the referral slip. Okay, they will write that why patient came to you, what treatment is given, and what is needed from the higher center. Okay, that should be entered in the referral slip. After making this referral slip, the details are also entered in the referral register for the record. Okay, so one referral register will be there. We will enter all the details in the referral register and then give that referral slip to patient and ask him to go to CHC or higher center. Okay, and if the condition is serious, even serious patient may come at PHC, then immediately the client should be accompanied by a doctor or the staff to the higher center. Okay, and if there is no emergency, then can go on his own. Okay, so this is the referral system. Then the client will reach to higher center. That higher center will be known as receiving facility. Okay, so receiving facility at first level will be CHC. So from PHC the client reaches to the CHC. They receive and attend the patient. They provide best possible diagnostic, therapeutic services to the client as written on the slip, and they also enter in their register, that is also known as referral register, receiving referral register. They will enter the detail and provide treatment, 1 day, 2 day or 3 day, or if only diagnosis is done, then the test is done and client is sent back to the PHC. Okay, after providing the services, the detail of services given at receiving facility should also be entered in same referral slip which client has. Okay, and again we send back the client to the initiating facility, means to the PHC, and follow-up treatment will be given by that PHC only. Okay, and again the details are entered in the referral register when the client came and when it was sent back. Okay, so these detail will be entered. Now we come to the referral slip. What is referral slip? Referral slip is a referral form which is filled by the medical officer of initiating facility. Okay, the client referral form or referral slip should be filled by the medical officer of initiating facility and should be handed over to the patient. Referral slip is standardized throughout the referral network. Okay, they are provided by the department and they are standard. The same essential information is conveyed by the referring and receiving organization. If we see the sample, we can say that the referral slip is divided into two sections. Okay, part A and part B. So what are those? Part A, the referral slip is completed by the organization making the referral, means initiating facility. They will fill form A, part A, and the medical officer of receiving facility, he will fill the part B. Okay, so this is the referral slip. You can see this is the sample referral slip, part A and part B. So part A contains the name of initiating facility, means our PHC from where we are sending, and then it is also written receiving facility to where we are sending. Okay, the name of the patient, age, address, and then brief clinical note. Here clinical note is given that when patient came with these problems, then we have given some medicine and provisional diagnosis, what provisional diagnosis is there, and then referral serial number as per the register it is written, and then three points are there, A, B, C. Why it is sended? Why we are sending the client? A, admission or treatment at the higher facility. B, investigation for ultrasound or X-ray, what investigation to be done, and third, for consultation. Okay, so in this way we clear cut write what treatment is needed, and then signature of the medical officer with stamp. Okay, so this slip 1 is part 1 is filled by referring facility, and then this is left blank. Okay, now receiving doctor will give treatment, and then when he will send back the client, he will fill the part B. Okay, here he will write clinical summary of or investigation done, what is treatment given, and then signature and stamp. In this way he will send back. Okay, here one more thing come. If the client again needed the services of secondary referral unit, then he will not fill the part B. He will again make new referral slip and will fill part A again. Okay, and then send to the higher facility. And after taking the services from the secondary referral unit, they will come to first referral unit and then to PHC. Okay, so this is a system by which the client should be referred and received. We can understand this from this flow chart, that this is PHC and this is CHC. When the client come, consultation is given, referral form is filled, part A is filled, and then client is sent to the, after entering in the referral register, they are sent to the receiving facility. Okay, at CHC, part treatment is given, then part B is filled, and client is asked to report to the again PHC. Okay, at PHC, follow-up treatment is given and treatment is completed. Okay, so this is all about referral system. Many times this question comes in exam.